All right. Hello, everyone. My name's Dr. Leanne Rogers, and I'm going to be your guest lecturer today on the topic of fall risk and treatment. So we will go ahead and get started, and I hope you guys enjoy the lecture. Okay, so our problem is falls. Falls are the leading cause of death from injury in elderly persons. Unintentional falls were the leading cause of injury-related mortality among Arizona residents 65 years and older in 2014. 1 in 3 Americans aged 65 years and older falls every year. Every 15 minutes, an older adult is treated in the emergency department for a fall-related injury. Falls are a major source of disability through fractures, activity restriction, and fear. So how many of you feel and believe that falls are preventable? If you said yes, you're right. Falls are largely preventable and they're not a result of aging. So we're going to learn how today. So today's agenda will cover what is a fall, talk about what is balance. We'll go over motor strategies for balance, talk about risk factors for falls. We'll look at some evidence-based exercise programs specific for balance, and we'll go through components of your evaluation and examination for a balance patient. Alrighty, so what is a fall? It's landing on the ground or some lower surface when you didn't intend to be there. This includes slips and trips. What is balance? Balance is the ability to control and maintain your body's position as it moves through space. Now, this requires coordination of sensory systems. So 3 of them, your visual, your somatosensory, and your vestibular. Okay, your visual system, it gives you input on the position and orientation of your head along with the direction and speed of your head movements. Your somatosensory system provides input on how the body moves relative to the support surface. So receptors such as your Golgi tendons, your muscle spindles, your joint receptors, and skin mechanoreceptors are all part of this system. And lastly, your vestibular system provides information on the position or movement of your head as you move and change positions. So most importantly, balance is a skill. It's a learned motor pattern, and your patients can keep it or relearn it by practicing it. So don't let them think that just because they've always had poor balance that they can't do anything about it. Okay, so here are your motor strategies for balance. You have 3 of them. You have an ankle, a hip, and a stepping strategy. All right, so your ankle strategy comes into play with small external perturbations. And a muscle activation will occur from distal to a proximal sequence. So for example, if your perturbation comes from posteriorly, your gastrocnemius will start activating, and then your hamstrings and so forth. And your hip strategy will occur when you have rapid or large external perturbations. And this uses a hip flexion or extension to return your center of mass over your base of support. And the muscle activation happens from a proximal to distal sequence. Again, depending on which direction that perturbation is coming from. If it's from the front, then your abdominals will kick in, and then your quads, and so forth. I like to think of the hip strategy if you can visualize a gymnast on that balance beam, and she does a little jump or a flip, and she lands, and she starts to lose her balance. You can see her really kicking in that hip strategy to prevent herself from falling off that balance beam. And lastly is your stepping strategy. Pretty straightforward. when the perturbation is so great that your ankle and hip strategy cannot compensate for it, you basically end up taking a step to prevent yourself from falling over. All right, moving on. So we're going to talk about risk factors and how do you know if you're at a risk for a fall? So some of these risk factors are being 65 years and older, having a fear of falling, having an unsafe home environment, currently taking 4 or more medications, having poor vision, physical inactivity or lower body weakness, poor balance, or having a chronic disease. All right, so fear of falling matters. Having a fear of falling can stop a patient from activities. It can lead to a loss of confidence in one's ability. The inactivity may lead to weakness, can also cause social isolation, a functional decline, and that fear can also cause depression. So that fear of falling is rather an important component to that patient, which is something you should always ask, and we'll go over that in the evaluation. All right, so your environment recommendations. You want to identify and eliminate fall hazards in your home and community. So if you have loose throw rugs in your home, poor lighting, slippery bathtubs and showers, clutter and obstacles in walkways, loose cords, unstable stools or chairs that they may use to reach things in the cabinet or higher surfaces, and then having hazardous steps or curbs. All of these are hazards for creating a fall in someone's home. So here are some examples of how to adapt someone's home to help them prevent a fall. So you have grab bars near the toilet or in a bathtub to help them step in. If someone has a few steps into an entryway, or this looks like a garage, they added some handrails there for safety. So these are just a few examples of how to make one home safer. All right, we're going to talk next about medications and fall risk. So side effects may make a patient dizzy. Medication changes can increase fall risk. You want to make sure your patient uses just one pharmacy and that they also have an annual medication review. And you want to make sure your patients can read their labels. All right, vision and fall risk. You want patients to have annual eye exams after age 50. And if they wear multifocal lenses, that can blur or distort their vision when looking down. And removing cataracts may reduce their fall risk. All right, here are some chronic conditions that can contribute to a person's fall risk. So if you have diabetes, arthritis, suffered from a stroke, any neurological disorders such as Parkinson's or multiple sclerosis, depression, chronic obstructive pulmonary disease, and chronic pain. Okay, that chronic pain can alter movements and reduce a normal stability limit, and also cause secondary strength and mobility impairments, which can lead to falls. All right, so now we're going to talk about 3 different evidence-based balance programs. Your first program is called the Otago Exercise Program. It's a series of 17 strength and balance exercises delivered by a physical therapist in the home. Now, this program is mainly for your frail older adults, people aged 80 and older. This program is performed at home 3 times a week, and it includes a walking program. And it's a total of 24 weeks long. Okay, and this has been proven to reduce falls between 35 and 40%, again, for a frail older adult. The next exercise program is called Matter of Balance. It's an 8-week structured group intervention. It includes exercises to increase strength and balance, and it emphasizes practical strategies to reduce fear of falling, set goals to increase activity, and change home environment to reduce fall risk. So it's also very heavy on the educational component as well as the exercise. All right, and the last evidence-based program is Tai Chi. Tai Chi is a traditional Chinese exercise program. This program does not include an educational component. Tai Chi is typically performed in a slow manner, focusing on breathing, posture, and weight shifting. There are 4 styles of Tai Chi: your Yang, Chen, Wu, and Sun, with Yang being the most common. And Tai Chi is a great program for maybe a patient that you are discharging and they want to continue with a program besides their home exercise program. Tai Chi is usually offered at senior centers or at a YMCA, so it's a great transition program for these patients who are being discharged from physical therapy, and having them continue and still knowing that they're getting balanced exercises, and that's going to be beneficial for them, especially since a lot of the Tai Chi programs are evidence-based programs. So this is a great program to refer patients to once they're done seeing you. All right, so on to your evaluation and examination of an impaired balance patient. So, just like any other evaluation, you're going to start off with your subjective. You want to know their mechanism of injury if they sustained a fall. You want to ask them if they have a history of falls, specifically within the last year or so. You want to ask them again, like we talked earlier, if they have a fear of falling. And then gather their chief complaints of what is bothering them. All right, so on to your objective component. You're going to go through your manual muscle testing, range of motion, a gait assessment. You're going to go through specific outcome measures, and we'll go over that in the next slide. And then any special test that you may need to perform, depending if you're looking at a certain joint, whether it be the shoulder, the knee, ankle, either of those. You would use special tests that are appropriate. Okay, so here's the outcome measures for fall risk assessment, and this is taken out of your book from table 8.2, I believe it was. So if you are not familiar with these tests, we'll have some copies at lab and we can go over them in more detail there. So some of these tests that you can pick from are your Berg Balance, a Tinetti Performance Oriented Mobility Assessment, and your Tinetti test involves a balance portion and a gait portion to test them. You have a timed up and go, a 4-square step test, a dynamic gait index, a functional gait assessment, 5 times sit to stand, an ABC scale, and a 10-meter walking test. All right, so exercise prescription. This is from the ASMC guidelines on neuromotor training. ASMC recommends 2 to 3 times a week for 20 to 30 minutes per day. And these exercises should involve motor skills, proprioceptive exercise training, and multifaceted activities such as Tai Chi and yoga to improve physical function and prevent falls in older adults. And your motor skills are going to be balance, agility, coordination, and gait training exercises. Okay, so now that you got your evaluation component done and you know what your patient's impairments and deficits are and where their weaknesses are, it's time to prescribe some exercises and treatment. And that's where we will talk about all of that fun stuff in lab and go over ideas and progressions for patients. And we can talk more about those outcome tools if those aren't familiar with you guys, and learn all kinds of different things to prescribe a balance impaired patient. So if you have any questions, I'll take them there, and I will see you guys all in lab. Hope you guys enjoyed this lecture.